everyone. Hi. Today's topic of discussion, I think I'm live. Yeah, I'm live. Yeah, so today's topic of discussion is sex during pregnancy. And we will be having with us Dr. Tanushree. She's an obstetrician and gynecologist. Yes, and she will be answering all the questions that we have and all the questions that you have. Just give me a moment. Yeah.
Hey, hi.
Hey, hi, V. I forgot.
That's okay. I realized.
Okay.
But you're looking so good. Yeah, that's
Thank you
fine.
so much. I
I
hope you
don't think
forgive
new
me.
mother is seen. Yeah. No, no, no.
It will be seen shortly when the screen will be divided in two. Yeah.
Right. Yeah.
Yeah. So, yeah, let me just get Dr. Tanushree in. Okay.
Yeah, yeah.
Yeah, I've just sent her an invite. Let's wait for a while.
Yeah, she's. Hi,
Hello, hi.
I'm Vidya.
Hi, Vidya.
Hi, Dr. Tanushree. I'm Nilofer.
Hi, Nilüfer. So nice to finally be
How?
live with you guys.
Yeah,
Thank
same
you.
here. We are super excited to have you with us, and
Yes.
we're so happy that you accepted our request
Of
to
course,
join us
it's
on this
such a
live
nice thing
session.
you guys are doing. So much of awareness for mothers. It's a lovely platform.
Thank you
Thank
so much.
you. Thank you so much.
You look lovely in all your reels, by the way.
Yes.
Thank you.
And you're really informative, like really,
Thank
really.
you. Thank you
Thank you
so
so
much.
much. I mean, you are also doing a great job apart from handling your full-time, job. You're also creating so much of information to people. It's
Correct.
really, really a great thing to do. Thank you so
Thank
much for
you.
that.
Thank you.
And yeah, if you would like to, you can give a brief introduction about yourself, I think. We would love to hear a little bit more about you.
Right.
Yeah,
So I'm a
definitely.
practicing gynecologist and an IVF specialist. I practice out of Sion in Mumbai. And I also try and give online consultations in the areas where it is okay to have an online consultation, or then guide them to my hospital. So we have a whole center wherein we do everything related to women's health, whether it's obstetrics, gynecology, deliveries, cesarean sections, and then of course postpartum and childcare, whatever is required. And yeah, other than that, I'm trying to create as much of awareness as I can through my tiny page, Gyne Guru, on Instagram.
Yeah, that's a lovely thing. Thank you so much for that introduction. Vidya and me, like we started New Mother just last year. Our main intention is to spread the awareness about the importance of postpartum care for women. Like
Right.
usually, what happens after delivery, the child is given a lot of importance, and the woman is
Absolutely.
kind of she takes a back seat. So our
Very
main
true.
intention over here is to spread awareness that even you are important. Do not neglect yourself.
Absolutely.
This is
Absolutely.
something. Okay,
Right.
so I'll start with my first question to you. Today's topic of discussion is whether, how safe is having sex or intercourse during pregnancy.
Right.
We have a lot of questions prepared for that. We had a lot of questions from users as well, so we will go through that. But before going through all those questions, the first basic question that I want to ask you, so that if at all there is any kind of ambiguity among people who are watching this and who will be watching this in the future, we are kind of laying a good foundation. So can you please talk in brief a little bit about the female reproductive health, so that then from there onwards we can actually take up all the other questions.
Right. So I think this is a very important thing, and I would also sort of like to highlight where and when should women actually give sort of due care and importance to their reproductive health. What happens is we do realize that till a woman is not really pregnant, she thinks she doesn't have to really visit a gynecologist. So
Right.
firstly, I want to put that point across that the first time that you see your gynac is the time you want as a person who has a uterus, you want to get the HPV vaccine put. And that is the time between 9 and 15 years. That is the best time for boys and girls both. So there are so many patients who've now started coming in to give their children vaccines, which is great, because when I was growing up, it wasn't a trend to, take your daughter and son and get the HPV vaccine done. So that is one thing, because then you need only 2 doses, and the HPV vaccine is most effective when put before sexual activity is attained. But if you miss the boat at that time, you can get it put till 45 years of age. So even if you're not pregnant, you should visit your gynecologist for the HPV vaccine and for something known as a pap smear, which is the test that is done of the mouth of the uterus, the cervix, and it helps you screen for cancer cervix. So that's the most beautiful part, that cancer cervix is the second most common cancer in India, but yet if caught at the right moment, it can be easily cured. So, these are 2 things. So pap smear in India is done either 3 years or 5 years, depending on which test are you doing. And then, of course, for a breast examination. So an annual visit to a gynecologist, even if you're not pregnant, is a must. And then about the reproductive, a little brief about how does the reproductive cycle work and how our body sort of ages. Unfortunately or fortunately, we as women are already born with a certain number of eggs. So, our reproductive cycle is decided in our womb. So it's, even though we want to talk about empowerment and all, but the truth is that we do come with an expiry date, unfortunately. So, our ovaries do come with an expiry date. And because of our careers and professions, it's not easy for us to, get married tomorrow, have a baby 1 year later, just like it used to be in the older days. These days, we have to settle down. There's so much that we have to first focus on before we can actually decide to have a child. So I would always recommend my patients go get your AMH done, get your follicle study done, so that you know that you have a good reserve of eggs. Your doctor will help you with that. Okay, you can wait for at least 2 years. It's okay to wait for another year. If there's a problem, the doctor can intervene then and there. There are varied options now, from medicines to, if somebody wants to go in for freezing their eggs, if they don't want to have children for a certain amount of time. So these are things that even when you're not pregnant, you should go to your doctor too. And then, of course, don't ever take, intermenstrual bleeding, infections, discharge, all these things lightly. These are small things, but they lead to major complications.
Right. Thank you for that, doctor. That was kind of quite insightful, and I think we all have some action items now, including
Yes. Moving on to next question. Is pregnancy sex safe?
So yes, see, I'll always say when we talk about pregnancy, any pregnancy has certain risk associated with it. So like I always say, that there is no risk pregnancy. It is either low, moderate, or high risk pregnancy, because pregnancy is a hyperdynamic state. It's 2 lives involved minimum. So it's definitely not a no risk. So when pregnancy is low risk, there are no, the placenta is not low lying, or there are no signs of preterm labor, there's no infection, there's no pain, there's no bleeding. Sex during pregnancy at any time is safe. But having said that, if any of these things are there, then you have to consult your gynecologist before saying that. So every pregnancy differs, and just like that, is sex safe in that pregnancy or not, differs. But if you talk about a low risk pregnancy, it is safe.
Right. I just want to add one thing to that, Dr. Tanushree. So, we are talking here about penetrative sex. So, if not penetrative sex, then other forms of sex, like say, for example, oral sex. Oral sex is okay during, can oral sex be done in low, medium, and high risk pregnancies?
Absolutely.
Or should that?
Absolutely. So, as far as foreplay is concerned, as far as arousal is concerned, as far as stimulation is concerned, as long as it's not penetration, it can totally be done in any month and at any kind of pregnancy. There's no problem with that.
Okay. So anyways, the satisfaction level of women or anything, that's not going to hurt the baby or cause any kind of any kind of issues with the baby. I just want to clarify, because we had a couple of questions on this.
Right. So no. So see, here I'll just sort of deviate a little from the topic. What happens is, during your pregnancy, all hormones are at a rise. Estrogen as well as progesterone. Now, estrogen is the hormone which makes a woman feel like having sex. It's the hormone which increases the libido in a woman. So in certain pregnancies, estrogen dominates. Okay, and in those women, they have an increased libido. Now, it may not be the same all 9 months. Initial 3 months, because she faces a lot of nausea, she's getting used to the pregnancy. She may not feel like having sex, or may not even feel like being aroused. But the second trimester, when she's gotten comfortable with pregnancy, when her hormones have risen enough, she might feel like all the kind of, and now she doesn't have the stress of getting pregnant. She's already pregnant. So, that stress and that inhibition has gone. And the tummy is not that big, because in third trimester, then sometimes women face a problem that, my tummy is coming in way. So no matter how aroused you are, your hormones are not going to affect the baby. Now, in the other women, where progesterone takes the lead, libido might completely die. All 9 months, the woman may not just feel like having sex. And that is also normal. Whether you have an increased libido or a decreased one, it's not going to affect your baby at all. It's just going to make your pregnancy more pleasurable. That's it.
Right.
Okay.
Thank you so much for that. So, we had questions on orgasm. So, orgasm, if a woman orgasms, it's no way going to affect her baby. I'm just reiterating.
Not at all. So what happens is, Nilofer, sometimes when, even in a non-pregnant state, when a woman orgasms, she might get like a short burst of pain or a cramp in the lower abdomen, which may be misconstrued by a pregnant woman as false labor pain. That, oh my God, my tummy is cramping, and what is this? Why am I feeling this kind of pain? But then you have to tell yourself that it's a part of a normal orgasm, because your muscles contract. So sometimes your pelvic muscles contract, and which is absolutely normal. So it is going to subside in the next 2-3 minutes. If it doesn't subside, and if the pain is sort of lingering on for 4-5 hours, then it's a completely different situation caused by something else probably. That time you should go and show yourself to your doctor. But otherwise, no. Orgasm, you might be scared, because there's a lot of misrepresentation of orgasm leading to preterm labor, orgasm causing labor. All that doesn't happen. Orgasm and labor are two completely not related things.
Okay, thank you so much for that, doctor.
Yeah, my actually next question was that, is there a chance of preterm labor during pregnancy?
So see, now this question has to be handled again in
just to clarify, so sorry for that. But the questions that I asked Dr. Tanushree were only irrespective of the risk level of pregnancy.
Of course,
I asked her, if you are going in for oral sex, then does an orgasm cause any issues?
Absolutely.
But
so in that case, no.
Relevant, because if you're having penetrative sex, is there cause of preterm labor? So you can still go ahead with your question.
When it comes to here, now we are discussing penetrative sex, or inserting a sex toy, or inserting your fingers in any of these things. Basically, insertion of anything. So here, two things that definitely have to be ruled out is, one, that your placenta is not low lying. So because in that particular condition, a doctor also doesn't do a vaginal examination. We also don't, even for the examination part, we don't put our finger in. So that is one place where it's a complete contraindication. Secondly, if you are susceptible to preterm labor, meaning if your cervical length is small, there are some patients who have to get a cervical stitch put in a twin pregnancy. Or you have certain ongoing infection, wherein the doctor has told you, no, I've given you certain medicine for the infection or whatever. In those cases, you have to avoid it till the time a doctor doesn't say that, it's safe. Otherwise, again, in a normal low-risk pregnancy, penetrative sex will not be the cause of preterm labor. If there is an underlying cause for preterm labor, it may get aggravated. So that's the reason that if there is a sort of decided cause, and the doctors told you to avoid it, then you have to avoid penetrative sex. Otherwise, penetrative sex won't lead to preterm labor.
Yeah, so low-lying placenta, doctor, that can be detected how early in the pregnancy? Because
so it can be detected very early in the pregnancy, like somewhere around 12 to 13 weeks. But at that time, we don't sort of label it that, because it's something known as the placenta sort of goes higher. So in most pregnancies by 16, 17 weeks, the placenta reaches the place where it's supposed to. So in that case, we tell the patient that these 5-6 weeks till your 18-week scan, avoid sex, don't have sex. And then once the placenta has gone up higher, then we say that, okay, fine, now it's safe. So, but
Yeah,
if you're continuously having bleeding, spotting, you're on a lot of progesterone, it's a high risk pregnancy. So then in that case, we tell you that first trimester, first 3 months avoid, so that by 12th, 13th week, we nicely see the implantation of the placenta. We see where the baby is, and then you are good to go.
Okay, thank you so much, doctor.
Yeah. Actually, my next question was that only, if you
Okay.
yeah. So, next question is, can a woman get pregnant while she's already pregnant?
Okay. So a woman cannot. Human beings, it doesn't happen like that. This is something that is seen, in fact, in dogs and a few other mammals, wherein the female dog can be impregnated with 2, 3 other dogs, and at one time the litter can have 2, 3 different sperms or fathers or whatever. But in human beings, it doesn't happen like that. The egg chooses one sperm, it gets fertilized, and in that time period when you have a baby in your womb, the egg factory sort of ceases. There are no more eggs that come out, so it doesn't happen like that. Even if it's like twins, triplets, whatever, is going to happen together in one cycle. But it's not like, in the second month or third month, supposing you have sex and then you're getting another baby which will be 3 months smaller. That's not going to happen.
Yeah. So what are the precautionary measures? Like if a woman is not aware, she has to check with her gynec before
Absolutely.
having an intercourse. Yeah. So what precautions she can take, or both the partners, and at home what she should be aware of after she has done intercourse and something happens?
Yeah, so this is a very good question, because what happens is now we as women, we feel that now we are pregnant, and obviously we're not getting pregnant again till we are pregnant. So there's no need to use the condom. There's no need to use any protection. Now what happens here is, again, I don't want to be very black and white in this, because if you are sure of yourself and you're sure of your partner, then maybe in those 9 months there's going to be no chance of a STD. But if there is any chance wherein the partner might have acquired some infection from wherever, you have to keep yourself safe during those 9 months. And that's why wearing a condom even during that part is not going to be like a bad idea, because you have to save yourself from infections. Because if you get a pelvic inflammatory infection during your pregnancy, it's just going to lead to complications in pregnancy or preterm labor. So that is not a good idea.
Right. I think we got a question.
Yeah.
What is I think it's gone
Can
out.
the ovulation stick show positive in subsequent months, even if pregnancy is there but not detected yet? So I guess what they are trying to ask is that, say, like a woman has conceived, but she is not aware that she has conceived, okay, and ovulation stick. Okay, no, I'm not getting this question. I'm just going to
No, it
repeat the
won't.
question.
Whatever the bottom line
Okay.
is, the ovulation kit will only come
Yes.
positive when you're actually ovulating, when there is a LH surge. So once you're already pregnant, there is no LH surge. Your LH levels and all have reached a certain height. My question is that why would you do an ovulation kit at that time? Because
Exactly.
in a normal cycle, if it's a 30-day cycle, you are going to be ovulating mid-cycle. And now that if you've skipped your period, instead of doing a ovulation kit, you should take a urine pregnancy test rather. Your HCG levels will be rising at that time, and that kit will show positive, not your LH kit. That is your ovulation kit.
Right.
Why does the skin, especially around the tummy, itch during pregnancy? You want me to take that question?
Yeah, you can take
Yeah.
it.
So it's simple, your tummy is expanding, your skin around it is expanding. And just like how you get dry skin during winter months, you get dry skin during pregnancy, because that amount of, it's not like skin is also growing proportionately with your pregnancy. So it expands, it stretches, it's an elastic thing. So that's why you have dryness and itching. So you can always use, any type of coconut oil, or, all these lovely lotions and things that are coming into the market these days. And not that they're going to help you from the stretch marks. Those are beautiful. They'll be there. Some stretch marks with pregnancy happen, and I think they're beautiful. That's the best part of motherhood, I think.
Yeah, just to add to that, I didn't get who asked that question, but we just did our last live session with Dr. Swati. She's a dermatologist, and we focused specifically on stretch marks. So I think you should get a lot of information from that session as well. We can share you a link if you can drop us a DM after this
Yes.
session. Okay. Yeah, you continue, and then I will ask, like, there were a couple of questions, like
Sure,
on a
sure.
story. Yeah.
Yeah. So, I mean, there is another option like to induce labor. So, sex can be used. I mean, sex is, I don't know how to put it. Yeah, can sex be used as for inducing labor?
Now that is a myth. Now this is again like what happens is when you orgasm or when you're having sex, it can cause like a sort of a small contraction in your tummy, which might give you a false implication that you're inducing labor, but it doesn't work like that, because that contraction is sooner or later going to go. Labor pain requires a major, huge chunk of contractions, oxytocin being secreted, your baby kicking. So it's a whole different reflex, and little bit of sex is not going to lead to labor pains. If it was that easy, trust me, a lot of women would have ended up in labor pain.
Yeah, I just have one question over here. There have been some doctors who do suggest, like, having sex at the end of your pregnancy, 8th or 9th month. So what
Right.
is the reason for that? Like
See,
most of the doctors tend to advise on that, right?
Yeah.
no, so there is no evidence-based research which says that sex is going to lead to labor. It may be, because it's like women feel that way, and there's no harm in it. It's not like it's going to cause any harm to it. So, doctors also say that, tomorrow the patient shouldn't feel that we hindered them from having sex, or we said don't have sex, and that's why she ended up in a C-section. So it's just one of those things that it doesn't really make a difference. So if you want to have it, and if 1% chance is increasing, so have it, enjoy it. If nothing else, it's helping you make your pregnancy more pleasurable, making your mood good, secreting the happy hormones. Good. There's no
Yeah.
problem with having sex. That's the thing.
Yeah, there's another question. Is it safe to have sex with low-lying placenta? I think Dr. Tanushree
No,
already answered that.
absolutely. Yeah.
Yeah.
So, in no way sex is going to affect the baby.
No. So no, it doesn't affect the baby. Your baby is not going to be born with some deformity, or the baby is not going to have any, I don't know, moral issues. No, it's not going to affect
Yeah.
it.
No, yeah, that was another question that we had since we are already talking about it. There was a question that will it spoil the kid's mind?
Yeah, so no.
I would like you to answer that.
The kid is going to have a beautiful mind of his or her own, and whatever you watch, whatever you listen, the only thing that is really going to impact is your mental health, your nutritious health, what are you eating, what is going inside your tummy, your weight gain, your basically how your body is responding to the pregnancy. And as long as your scans are showing a normal baby growth, the baby parameters are normal, and you are healthy, nothing else is going to affect the baby. So no.
Lovely answer that was. Thank you so much. Really loved that
Yeah.
answer. Thank you.
Okay.
Yeah, there's another. If you want to take up another question, you can. Then I can ask
Mm,
those questions.
I think this is the last question from my end. So, how sex can help a mother? What are the benefits if
Right.
for the mother,
Right.
physically and emotionally?
Right. So, recently even I covered this topic on my page. People always think that pregnancy is supposed to be this all happy, happy, joy phase. The mother is supposed to be happy 9 months and feel so great about being pregnant and whatnot. But that doesn't always happen. There is something known as pregnancy blues. There is something known as postpartum blues. And just like a normal woman, when she has sex, or when she is aroused, or when she has, any form of foreplay, there's a lot of happiness, a lot of content in a person. Why just a woman, a man, whatever it is. So it's just the same thing. It is making the woman go through a pregnancy easily, feel connected to the partner, because you have to understand, a woman goes through so much more than just being pregnant. She's putting on weight. She has all sort of insecurities at that point, that I'm now going to be a mother, maybe my partner doesn't find me attractive, I have put on weight here, I have stretch marks here, I'm not looking as attractive as I used to. And all these little insecurities, your partner sort of gets rid of it, and then you get a good night's sleep, you feel happy, you feel confident, you feel connected to your partner. And at the same time, it's for the partner as well. I mean, come on, it's not his fault or her fault, fault also, that just because you're going through pregnancy, you're denied of all the pleasures. So I think it's for both the partners in the relationship that you're just doing what you were used to doing or what gave you happiness.
Nice.
Thank you. Thanks, doctor. Yeah, I'll just take up this another question that we had just now. Yeah, there were few questions. I think we can just I can just read them out. Is it at all safe if it's a low risk pregnancy? I think Dr. Tanushree has already answered that question. Yeah, most of the questions are regarding that only. Yeah, there's one question which is a little different. I'm not sure if it's related to this, but I'm still going to read it out. Is it okay to choose not to be pregnant forever, but have active stay? I think she means sex, but have active sex if I don't want a child. Will there be any health issue?
So see, the health issues is if you never go through pregnancy, I mean, that is completely your choice, absolutely. But I would just say that then use proper contraception and be safe that you don't have an unwanted pregnancy, and then you have to go through all the hormonal imbalances and all of that. And then of course, yeah, get your routine scans and checks done. After 45 years, we do CA125 hormones to see if your ovaries are fine, your uterus is fine, no type of cancer, fibroids, etc., etc. So basically, like I said, that pregnancy is not the only time you should be visiting your gynac. So just because you've chosen not to be pregnant, don't forget about your annual visits, and contraception then becomes a key for you. And then have safe sex as much as you want.
Yeah. Thank you so much for that, doctor. Vidya, we also had a last question, right, regarding
Yes.
Dr. Tanushee's advice.
Yeah. Oh, okay. There's one more question here in the comments.
Okay.
Ma'am, could you please repeat the name of test checking follicular quality?
It's called AMH, anti-Mullerian hormone. Now that's an expensive test, so don't just get it done over the counter. Go to your gynac, whoever you're visiting, and let her suggest it for you, because we don't do it in every patient. We do the scan. If we see that the follicles are less or whatever, then we advise an AMH. So it's not done for everybody, but yeah, that is the test, anti-Mullerian hormone. It tells you the quantity of the egg reserve that you have.
Okay. Thank you. Yeah, Vidya, you were taking the last question?
Yeah, no, you can take it up.
Yeah, so ending the session, it was a lovely session. Okay, we learned so much today from you, Dr. Tanushree.
Thank you.
We have one last question for you. What is your advice on this particular topic, sex during pregnancy? If you have to advise something, what would you suggest to all the people?
So see, I'll be very honest, and maybe some doctors don't even agree to what I counsel, but this is the counseling that I give to my patients, and I shouldn't speak otherwise, because I'm sure they're also watching it and they'll be like, but OPD mein to ma'am ne kuch aur bola tha. So when the patient comes for the first UPT, I do tell them that you wait, don't have sex or penetrative sex for the first 11 weeks till the time we do the first NT scan. My personal belief is because sort of the endometrium is getting thickened, the placenta is taking over. The first 12 weeks, a lot is happening in a woman's body initially. She's also going through a lot of nausea, vomiting, changes in her body. So first 12 weeks, I let her get used to the pregnancy, give it a break, get the 12-week scan done, which is known as the NT scan or the aneuploidy scan. And in that, once I see that everything is fine, the placenta is fine, the fetus is nicely implanted, the heartbeat is great, and if it's low risk, nothing else is problem, they are absolutely safe to have sex and how much ever sex they want or whatever. I always tell them that they might have some amount of spotting post-sex, because the cervix becomes really soft, and all the tissues, the vagina, everything becomes really soft during pregnancy. So a bit of spotting is normal. But if you see a lot of blood, if it's like, period blood, you should immediately go to your doctor. And other than that, as long as you feel like having sex and it's safe, go ahead. If you don't feel like, there is no pressure, then you just talk to your partner. You explain to your partner that, there are so many changes that I'm going through, and some women do feel like having it, but I don't. My tummy size is increasing, I'm feeling bloated, I'm having all sort of mood swings. So I think either which way it's okay. There is no mandatory rule to it. But for me personally, first trimester, if you can avoid it, great. If you can't, evidence doesn't support what I'm saying. Evidence says at any time, if it's a low risk pregnancy, you are good to have sex. But I personally is just like, how in the olden days, first 3 months were very crucial. So for my patients, I personally say, because these days every pregnancy is such a precious pregnancy, So I just prefer that let the child nicely settle and you settle in with your pregnancy, and then you go ahead with whatever you want.
Okay. Yeah, that's what even my gynec had suggested me.
Yeah,
Thank
so
you
that
so
is
much.
what, see, every time you can't follow the book to the T. So if you see American guidelines, you see British guidelines, they don't say this, what I'm saying. But then I've seen enough patients for my own guidelines, so to say. So I like to stick to that. If it's not absolutely necessary, give it a break of 3 months.
Okay.
Yeah.
Thank you so much, Dr. Tanushree. All the inputs that you gave for this session, I'm sure they will be very helpful to everybody watching this session now and later. Thank you so much for providing all really good stuff, really good information over here to us. Okay, thank you so much, and thank you so much for joining us again. It was a pleasure. It was great having you here. And both Vidya and me, we really enjoyed the session. I really enjoyed the session. You can talk on your behalf. I really enjoyed it. And I learned a lot more. I'm taking back something from this session. So thank you so much.
Yeah,
Thank you.
it is definitely. It is, every session, like it's more, I'm not sure how many people are learning something, but we are sure learning in every session.
Yes, yes.
No, I'm sure. Your page is so informative. So many lovely mothers and people who want to conceive, trying to conceive, whatever. Just one last thing I want to add before we end this: that we've spoken so much about pregnancy, and since your page is all about postpartum mostly, absolute no to sex for the first 6 weeks after you've delivered, whether it's normal delivery or cesarean delivery. Now that is one time which is not negotiable. Whether you've got a stitch, whether you got a perineal tear, whether nothing, first 6 weeks till the time you go back to your gynae, she examines you, she checks your stitches, whether abdominal, lower, or your vaginal, your vulval stitch or whatever, or nothing at all. You're absolutely safe, no stitches, still no sex, nothing at all for the first 6 weeks, because you are too weak at that time and too sort of friable to infections. Let your body heal for those 6 weeks.
Thank
And
you so much.
yeah.
Again, I love this answer. I really love this answer. Thank you so much. And this is not only what Dr. Tanushree is recommending. This is, I guess, what throughout the world, all medical
Yeah,
boards
this
recommend.
is
Right?
like a guideline, absolutely. But thank you guys for having me over, and I think we should do this more often, because I love the audience, I
Definitely.
loved you guys and the whole, I think, community that we've created.
I also love the
Thank
vibe we
you.
are having right now. So definitely let's plan for another
Yeah,
session. Thank you
absolutely.
and
Thank
have a
you.
happy weekend.
Yeah,
Bye.
you too. Bye bye. Take care.